the topic of Lyme disease. Will you please shed some light on Lyme symptoms and mimicry and help our friends know what they should do if they suspect Lyme?
You're quite right. Lyme disease is in vogue in fashion. It is a very ill-defined syndrome. Almost every specialist who treats Lyme disease has a different definition. It's called the great mimic of our time because of this imprecision. And we don't, even as a laboratory physician, I don't really know easily what the correct tests to do are. So let's start with what it is, and let's start with what people think, and then why is that incomplete, and what would I do as a consequence. Lyme disease was diagnosed in Lyme, Connecticut, not too long ago. This would have been in the early 1980s. And it was originally considered to be very specific for a rickettsial organism called Borrelia. And if you can spell Borrelia, then I have to say Babesia and Ehrlichia, which are other organisms that are similar but distinct, each of them having a different antigenic or immune response profile. And if you want to get into the weeds with me, there are actually several other organisms in the last few years that have been associated. But what is Lyme disease? Syndrome. It's not really a disease because a disease has a specific cause, whereas Lyme has multiple associated infections and immune dysfunctions. So it's a syndrome. And the Lyme syndrome is something that I believe we will understand better when we take a moment to talk about hepatitis and then come back to Lyme. In the 1960s and 70s, hepatitis A, B, C, D, E, F, G were eventually identified. And with regard to hepatitis, what we found was that antibodies against hepatitis were entirely misleading and useless in clinical practice. We had to look directly at the antigen, the infectious antigen, the foreign invader antigen. And then we had to look at the capsular part of the hepatitis, the inner aggressive part of the hepatitis, not the antigen on the surface of the hepatitis. And who did this work? Harvey Alter, a colleague of mine at the clinical center. He had worked with Bruce Blumberg, who got the Nobel Prize for their work on hepatitis. And I had the privilege of studying with and publishing with Harvey Alter. I'll talk about that another time. But Lyme is a syndrome, and what doctors generally do is they look for antibodies, they look for immune reactions that say the person has been exposed to, say, Borrelia, Babesia, or Ehrlichia. And I've told you with regard to hepatitis, and I'll tell you with regard to any chronic infection, all and any chronic infections, and we're talking about Lyme as a, quote, chronic infection syndrome. Antibodies will only confuse you. Antibodies will only confuse you. Now, today there are more advanced tests that look for antigen against some of these organisms in the urine or in the spinal fluid. But I don't recommend you rush out and have a spinal fluid test. So I want you to understand that Lyme syndrome results when the immune defense and repair system cannot identify these foreign rickettsial invaders. Now that's a reframing. What I just said is you do not have an antibiotic deficiency when you have Lyme syndrome. In fact, chronic Lyme syndrome, in my opinion, is a product of the treatment. The 6 months or more that people are treated with antibiotics induces what we now call chronic Lyme syndrome, which is different and, in my opinion, a bit more challenging than the acute Lyme syndrome. So if you have a bullseye or two indicative of Lyme syndrome, find an immunologist who understands immune defense and repair. Find someone who can identify the essential nutrients that you're lacking that you need. Find someone who can identify the toxin burden on your body and reduce that toxic burden. Work with someone who sees you as a person, who earns your trust, and who can help you evoke your healing responses. Because when we trust and understand, we get better results, and we do indeed evoke human healing responses. And when we don't understand, or when we're frustrated because the professional says, do this and just do what I say because I'm the professional. If you know any professionals like that, they have a problem. You don't. And in my opinion, you want someone who sees you as a person, who inspires and earns your trust, who is honest to say, we only know a little bit, but we know enough to be helpful, and you are an individual, so let's treat you as that unique individual that you are, and let's approach health enhancement rather than syndrome treatment.